After the birth of my son, I experienced quite a rapid and quite a severe deterioration in my mental health. I think at the time there was a bit of focus by myself and my family placed on some challenges that I was having with feeding, and that became a real central focus, and there wasn't as much focus on my deteriorating mental health. I wasn't really aware what was happening to me, and neither was my family. My pregnancy had been planned, and we were all so excited about the birth of my son, and we didn't really know much about postnatal mental health challenges, that we were all caught quite unawares, especially in terms of how unwell I became and how quickly.
Amanda's description of a very rapid deterioration in her mental health, accompanied by fear, is a really common descriptor of perinatal mental health presentation. We are talking about mothers who've often had no prior mental health experience, who just very suddenly become unwell, are stricken with fear and not able to understand what's going on, and driven by a concern to look after their babies, push on sometimes beyond what is reasonable limits.
So the initial step for us was seeking the support of a parenting service that was assisting me with issues like feeding. And then at that time the referral process began, because it became apparent to them and to us how really unwell I was. I was starting to disclose intrusive thoughts to my husband and to my family, and we were all quite frightened. So from there, I had a series of admissions to inpatient units over a really short period of time. So this began about 6 weeks after the birth of my son. When I arrived, I was quite unwell. I hadn't been stabilised on any medication, or I hadn't had effective treatment. So subsequently, I was experiencing sleeplessness, loss of appetite, and all of the symptoms that were part of my depressive illness. So that was really challenging, and then mixed with the environment being quite scary, and a feeling of that go along with the illness, feeling quite low and putting a low value on myself.
The priority would be for the woman or the mother to be treated in a psychiatric unit and kept safe. We know that some women feel unsafe. They feel frightened. They feel confused, they feel overwhelmed. They're in a psychiatric unit where maybe they haven't ever experienced before. The environment can be very alien.
It really resonated with me when Amanda talked about being frightened when she first arrived on the ward. I think sometimes as staff on an acute inpatient psychiatry ward, we can get used to the ward and forget what it's like to see that ward with our own eyes for the first time. It's natural that patients coming to a ward for the first time would feel anxious or frightened. One of the most important things we can do in that instance is to simply set expectations, give them simple information that's easy to understand about what that experience might be like. And that's one of the most important and simplest things we can do for patients. It doesn't really take much time either. It can just be 30 to 60 seconds, asking if they've ever been on an inpatient ward before, explaining what that might be like, explaining that they can go to the nurses if they have questions. That's one of the most important things that we can do to help people with their fears about coming onto the ward for the first time.
What I remember most is being frightened. It was a very confronting experience to find myself arriving in an inpatient unit, mostly because of lack of knowledge on my part, what was the trauma that was happening in my life and the challenges of the situation I was in at the time, but also just having no idea about what to expect.
A mental health inpatient facility is, I think, by nature for a lot of people, a really scary place to come into. Again, whether it's their first, second, or multiple admissions to hospital. The environment and how it's set up can be really protective, but it can also create a bit of fear. It's very unlikely that often a consumer would have chosen to spend such close time with so many other people in a space that's unfamiliar. So what we look at when we look at the wards is making sure that there are a lot of different spaces that people can go to and are encouraged to use either in conjunction with other consumers or by themselves. So Ward orientation should occur as soon as the person or the person and their family come onto the unit, and is a process by which you should be giving somebody an orientation to the physical environment, but also to the social environment as well. So what we're looking at doing is showing people around, primarily their room, and letting them know that this is their space and this is a safe space. So we're trying to build psychological safety immediately. We're also wanting to make sure that they know where they can access help when they need it and where they can access the things that they'd be able to access during their everyday life. So if you have them, this can look like things like mutual expectations or ward rules. It can look at things like orientating people to activity spaces and also to other consumers. So making sure that people have an idea as they come onto the unit what they can expect of the people who are around them.